We're here. We know that you have a high blood sugar and there's a foot ulcer that we're going to be looking at. Do you have any other concerns that I need to know about? When somebody's in the hospital, they're at their most vulnerable moment. And what other profession can you really help somebody when they're in that dire need? And so I feel like it's a very fulfilling career.
Does that feel better?
Yeah, that feels a lot better,
okay.
Actually.
One of our first classes of nursing school was all about caring for patients' mind, body, spirit. Their mental state is so important, and going and getting maybe a chaplain or something for them is so important because people don't want to take care of themselves if mentally they're not doing well. They need to have the right mind state and all of that, so that's how they're going to get the best care possible, is if they want to get better.
You're not just treating the patient, but you're treating the whole self. And so I feel like Rockhurst's value would align directly with St. Luke's, but also just the profession of nursing.
Basically like being a nursing assistant, and then you get opportunities to do more nursing things like starting IVs and that kind of thing.
We've been on neuro units, we've been on some cardiac units, and it really just gets you used to taking care of somebody that you never would have thought about or considered. So you get the opportunity through these clinical settings to hone in on that particular area, but also having the opportunity to maybe also take care of a spine patient in addition to a neuro patient. Okay, just a quick prick. How was that?
That wasn't too bad.
I accepted a nurse internship with the hospital, and basically what that is your opportunity to shine in front of the nurses and the managers at the hospital. And if you don't take a job on that particular floor, they'll find you a place.